Hi, folks. General Manager Tony Mazzucco coming to you with our weekly COVID-19 update for our weekly Facebook Live. We're going to go ahead and get started in just a few minutes with a couple of updates, and probably be a shorter one today, but we have a few updates for everyone. And in particular, we're going to talk a little bit about our numbers in the vaccine, and then we're going to go through some announcements. One announcement I want to start off with, very important one: the mailbox at the Civic for letters to the North Pole is only going to be there until Monday, so get your letters to the Civic by Monday. Hey, Catherine, thank you for joining us. All right, we're going to go ahead and get started here. We have some good and bad news. Actually, I guess the correct word would be we have some bad and some worse news as it relates to our COVID numbers. As everyone's aware, the state changed the framework for sort of ranking communities in the green, the yellow, and the red about a month or so ago. We had been in the red and the yellow. Then the state changed the framework. We dropped back down to, I think, green for a week and then yellow. Unfortunately, this coming week we will be in the red according to the state's calculations. The last 2 weeks we've seen about 175 positive COVID cases in Norwood. If you remember, when we were first worried about dipping into the red, that number was around 30 or 32 cases would have gotten us into the red. This is, of course, the state's new framework. So our 2-week number of positive cases is about 175. The state's final report will come out this evening. They'll have the final number, but we ran our numbers this morning. The other part of determining whether a community is in the red or not is the percent positive rate. Now, this is, as we've always said all along, the percentage of people getting tested who test positive. We had hoped that this number would be lower, that we would see more tests in the last 2 weeks that we've seen in the prior period of time. We unfortunately did not, and we're at a positivity rate of about 5.4%. So anything above 5% plus tests over a certain number puts you into the state's red category. Now, we haven't seen the data for the rest of the Commonwealth, so I don't know how many other communities are in the red. I do know that there were quite a few added last week, and my guess is if our numbers are similar to anyone else's, many more communities will be added into the red. So we do need to be cautious and understand that our numbers are continuing to climb. Since the state has come out with its red, yellow, green, gray framework, our numbers, they've slowed at different times. We did see a couple of a day crest about 2 weeks ago, but they've continued to climb and climb up from there, and we don't necessarily see that abating anytime soon. So that's a concern. That's sort of the bad news. We are in the red and our numbers are continuing to go up. We're still not seeing any one single indicator. We haven't had any large clusters in Norwood. We're mostly seeing the household clusters. It is still people coming from work and catching it at work, as well as, I believe the governor's term was small informal gatherings. We've seen some cases from Thanksgiving, but they've been relatively limited as of yet, although we expect more to come in. But they are coming in at times when folks are gathering with a lot of folks outside their household and also outside their circle. And when we talk about your circle, that's sort of the people you routinely see. And the best example of people who might be in your circle are people you work closely with. They may be friends or family that you do see regularly, maybe live in a multifamily home, or maybe your siblings always come over or something like that. So the cases are lower within people's circle in general, but they're lower among people who keep their circle smaller. And we're encouraging people, at least over the next few weeks and over the holidays, I know it's tough, to keep your circle relatively small. I've said all along, if you go out with somebody or if you're spending time with somebody, hopefully they've been well the last few days, their circle's not too large, and then just sort of be careful about where you're going after that. There's as much risk meeting somebody in your home as there is outside the home. I know there's some data that folks point to out there about restaurants. We have not seen any data about people testing positive from having gone to a restaurant. It's more that if you're going to a restaurant with somebody outside your household, that's really where the risk comes in. And that's the same really of any activity. If you're with somebody in your household, the likelihood is you're going to catch COVID if somebody else in your household catches it, if you end up being susceptible to it. It's when you expand beyond your household that you just want to be cautious about and try to limit those interactions. Limiting those interactions also helps with the contact tracing. That's a positive thing when we know exactly who you've been in contact with, and you can take a step back and say, okay, this is everyone in the last few weeks that I've been in touch with. So we're encouraging folks. I know the holidays are up. The analogy I think we used before as we went into Thanksgiving was, if you think of the rationing that people had to go through during World War II, maybe this is the best historic analogy to that. Ration visiting other people and seeing other people, try to keep it to a minimum. This couldn't be a worse time of the year for that. I know I look forward to Christmas parties every year in that sort of week or week and a half before Christmas, where you get to go to so many different parties at work and at friends' house and family Christmas parties. I mean, we have a family Christmas party that we've been doing for probably more than 30 years every year, and we're not doing it this year, and that stinks. That sucks, to be completely honest with you. I look forward to work and all the staff Christmas parties when you do the staff potlucks and everyone brings in everything, and you know who went and bought something at Shaw's, and you know who made something at home. I love those, and we do employee Christmas parties and stuff. I miss that. I love this time of year, but it's going to have to be a tapered down time of year. Julie, have there been cases from people going out to eat with people not from their bubble or family? So I'd have to dig into the numbers a little bit differently. It's likely yes, it's from the contact with that family. So let's say if you and your husband and your kids went out with your neighbors, and if you go to a restaurant and you sit down versus you go to your neighbor's house and you sit down, the risk level there is really close to even. Now, you're coming into contact with more people at a restaurant. However, there are rules in place at restaurants as well as at retail. You are wearing your mask until you sit down. The wait staff are wearing a mask. The cook are wearing the mask. If you think of two couples just going over each other's houses, one neighbor going and visiting the other neighbor, you're less likely to wear a mask in your neighbor's house. The person who's cooking is less likely to wear a mask. Now, there are some rule followers out there who I'm sure are probably doing that, but it's more the presence of you're in close contact with somebody else who you're not in your little bubble or in your family. Now, I do know some families, and I think this is very cute. Their kids are playing because they're neighbors, and it's sort of you can only play with the Smiths or the Joneses because that's sort of their little bubble. And I think if that happens to work, that's quite a cute thing that families can do. But it's mainly that your family is sitting down with other people outside of your bubble. If you do any type of similar activity, there's no the eating has nothing to do with it. If you two couples sat down to each other and played chess, I don't know if four people play chess, so maybe Monopoly is a better example. There's a risk of spread there. You're very close to somebody, you're talking, they're talking, droplets are going on, and masks aren't being worn. So whether that's eating at a restaurant or eating at somebody's house, that risk is really there, just as it would be if you were eating, just as if you were playing Monopoly or sitting down and I guess doing your taxes with another couple or something like that. So it's really about when you're interacting outside your bubble or outside your family. There's always that risk with your family, but as we've said all along, and it doesn't happen in every case, so there's obviously some immunity up there that we're not aware of, but if mom or dad end up testing positive for COVID, there's a likelihood that if not the spouse, one or two of the kids may test positive as well. I mean, you're a family, you're a household, you live together, you're constantly all up in each other's faces and using the bathroom and eating together. So we know that's going to happen, but me sitting down 2 feet from somebody and neither of us wearing masks, there's a risk of transmission there. And whether it's playing Monopoly, doing taxes, or eating, there's always such a risk there. Sorry, Catherine, taxes, I know I'm trying to come up with an example of what people would be sitting aside each other if they're not just eating or drinking. But that risk is really there any way you can do it. And I know it's harder now that before when you could go outside, because outside's always generally a little bit better than inside, and you can spread out further. If you had a restaurant where two families went and sat 6 or 8 feet apart and nobody came within 6 or 8 feet, sure, I guess that would be perfectly safe, but I don't think, that's some sort of a private dining arrangement. But there's always that risk when you're interacting with people outside your household and how frequently you're interacting with people outside your household. And I always use the example, if you have one couple that go out with another couple, that's not inherently unsafe. If that's the bubble that it's just these people together. But if one of those couples also goes out with 3 or 4 other different couples, well, now that's increased the size of the exposure. And then what if one of these couples has 2 kids at the Oldham and 1 kid at St. Catherine's and 1 kid at Zafarian, and then they go to all those schools and then they're interacting with all those kids, and all of a sudden that bubble starts becoming bigger and bigger and bigger. And that's where you all of a sudden have that increased risk. So we're in the red, and what that also means is we need to be aware that more people have COVID today than they did 6 weeks ago or 6 weeks before that. One of the nice things about the summer is our numbers did dip low enough that there was a reasonable determination that chances are somebody you're with wasn't likely to be COVID positive. Now we're up to a 5% positivity rate, whereas before we were hovering around 1 or sometimes 2. Well, that's significant, and I think that's going to go up, and that's a challenge we've got to work with. So the risk level is up, so you've got to sort of identify what you're doing and decide, what that risk level is. This isn't forever. There's a vaccine coming, and we're going to talk about the vaccine in a minute. It's just about, can we keep things under control for a while until the vaccine comes and until things get back to normal. I am confident with the rollout plan that the government's put together, and I sometimes question what the government does, recognizing that I work for local government. I think come April or May, you're going to see kids back in school. Moderna has been producing upwards of 1 million doses a day at risk since the summer. There is a lot of vaccine out there. There's a complicated supply chain. It's got to get out there. But we're almost through this, but it's sort of at the point where we just need to do it a little bit longer. I know wearing masks is uncomfortable. There might be a while before we can't wear masks in period. I know not seeing people and not going out as much is uncomfortable. And I know there's a lot of things that now it's gone on 8 or 9 months, or it feels like 100 years that we're not able to do, but we're almost there. The finish line is in sight. If you take things back to March, we were sort of reeling in March, at least in Norwood, when all of a sudden a bunch of us had a quarantine and COVID sort of hit us fast and early on. And it was this process of we were sort of behind the schedule and behind the times, and we were always sort of on the defensive. And then summer, when we were able to sort of open up Central Street and our numbers had come down and we were able to start with the outdoor dining, and we noticed that, hey, we can still do certain things in the midst of a pandemic and some great things that we're going to want to see continue. That was sort of our first chance to go on the offense. And, we've continued to go on the offense. The vaccine has continued to get tested. We've continued to refine our practices and our policies, both at the local level and organizations. I mean, it's negative news that we're in the red, but if you want to look at the good news, there was a point in time where we were worried we weren't going to have hand sanitizer. There was a point in time where we didn't have masks, and we were counting cloth masks by the day. Now there are masks everywhere. There's not a store you can go into that is not trying to sell you masks. And we can laugh at that, but I think we can laugh at it only thinking back to, 6 or 7 months ago when we were worried we weren't going to have masks. Does everyone remember the first month and a half of the pandemic when we weren't wearing masks? Remember, oh my God, it's a pandemic, it's terrible, shut everything down, and we still weren't wearing masks. So we at one point had hand sanitizer delivered by MS Walker, which is a company here in town. They're actually a liquor manufacturer and distributor, and they were able to make hand sanitizer with their alcohol materials and everything. And I mean, we were coveting it. We were going and picking up by the case, and we're like, oh, thank God, at least public safety and public health have enough hand sanitizer if they ran out, because we came close. So we've been through worse. The numbers are going up, but we're getting there. Question from Joe here. I work in a school that has only 1 case of COVID and receiving almost daily cases of Norwood. What do you think of the cause of such a high rate of COVID cases in town? Should we be cleaning the schools more? Are the right protocols in place when kids are sick? So that's a great question, Joe. Our numbers are not particularly higher than other communities, given our demographics. We do know that COVID does tend to spread around certain demographics, and the density of households is key. The type of work that people do is key. Your traditional white-collar work where people can work from home, the risk level is very low there. What we see in workplace transmission is usually people who have to work fairly closely together, utility workers, manufacturing, certainly people in retail where they're working with other people, and grocery stores. We're not really tying cases to grocery stores, except grocery store workers are really on the front line of this. In terms of cleaning the schools in particular, it's really a person-to-person spread. And early on, there was a lot of panic about the surface spread, and all the data that's come out since then is that the surface spread is really a very, very limited means of transmission. It really is person to person. The schools have additional cleaning protocols in place, and the schools are also closed on Wednesdays. At least this is Norwood. Every other town and the private schools I can't speak to are cleaning in, doing a deep clean on Wednesdays. They're using those electrostatic devices to kill virus and bacteria. and we're still not seeing those spread in the school. And I want to explain what that means, because some people say, well, wait a minute, there's cases in the school, but we're saying we're not seeing spread in the schools. For the most part, a majority of the cases we've identified of students in NPS, and this actually accounts for cases at St. Catharines because they're in Norwood, although we sometimes don't, we find out about them through the town where the individual lives. It's somebody was traveling, somebody was a family, somebody was playing sports. The actual rate of transmission in the classroom is minimal. That's specifically because of the work that NPS has done with the distancing, with ensuring masks are being worn, with taking good care of cleaning the building, operating on a remote learning academy, as well as the hybrid model. So in most of those cases, as they come in, it's, Billy tested positive, and it's because mom tested positive and mom is a nurse. Or little Joey tested positive and dad's a mechanic and he works closely with other mechanics, and one of those mechanics got sick. And as a result, Joey ended up testing positive or having to be quarantined. By and large, the compliance with contact tracing at the schools has been good. There has been some challenges occasionally, but that's something you see anywhere. What we've also seen is a good percentage, and I couldn't put a number on it, of cases, and they're cases that have either impacted kids in the schools or just in general, are people who are not following good practices. And I would go so far as to say that they're blatantly doing stupid things. We all sort of wear our masks, right? And sometimes, you take your mask off and you're walking out in public and you're not supposed to, and you quickly put it back on. It's not those rule followers. There are a small percentage of people who do really stupid things. It's tough to say that people go to work when they're sick, because sometimes you wake up and you feel fine, and later on in the day, I was having this conversation with somebody today, you think you feel fine, and at the point when you're sick, at least with me sometimes, I'm like, oh man, I'm sick, and it's like, wait a minute, I felt this way for hours, it just took time. There are times where people have gone and spent time with people in quarantine, and then they ended up testing positive because that person tested positive. I mean, that's stupidity. I couldn't put a percentage of the total spread in Norwood or anywhere in Massachusetts that's related to sheer stupidity, but I would bear to say it's a statistically significant number that there is some sheer stupidity going on as to why it's spreading. And you feel bad for the people who are locking themselves up and they're not going places and they're following all the rules. I mean, I know people, and I'm sure you do too, who have had to go out and get hand lotion because their hands are so raw from washing them so many times throughout the day. And, there are people who call us and they're in a panic because they hear about this and they hear about that and they're genuinely worried about the spread. Safe behaviors rarely lead to spread. Stupid behavior leads to spread. Now, I'm not the Secretary of Health and Human Services. I'm not the governor. I'm just a town manager, so maybe I can say it that bluntly. But stupidity is leading to a significant portion of the spread. Some of it is the nature of people working in close contacts are just not going to be able to avoid it. And some people don't know when they're sick, and they may never get spread, but they may never get sick, or they may never show, and as a result, they may not know. And that's sort of the silent killer that the governor refers to. When if you have a household of 4, somebody gets sick, and they just don't know it. They test positive, maybe they have no symptoms, their family has no symptoms, and then they spread it to people at work, and they just didn't know. But stupidity is definitely a contributing factor to people. To part of the spread. So Norwood, we talked back in the day, or back in March or April, we have a lot of nursing homes in town. There have been some, our nursing home cases have been better since they put in new protocols, but there have been some. We have a higher percentage of nursing homes than most towns. We do have a lot of dense housing. Norwood has 5,000 rental units, the majority of which is 2- and 3-family homes, and those tend to be more people living in a home. More people living in one home. We do have your demographics, and the reason it trends with demographics is usually families that are newer to the country tend to live in bigger family groups, and as a result, if you've got 10 people in a household, it's more likely to spread to those 10 people. If you have a household with 2, your maximum household spread is 2, or one additional person. So we have a lot of dense housing in Norwood. We have a lot of people. Remember, about on paper, 1 in 5 people in this community is a person of color, and the poverty level among that percentage of the population is higher. Now, why that corresponds to an unfortunate spread of COVID is these are the people who are working the kind of jobs where they were never sent home, they were never able to work from home, and they're likely to be in closer contact with people. Cafeteria workers, and we have the best in the state, if not the world, in Norwood, are an example. They've worked every day of the pandemic. So that's a job you can mask up as much as you want, but you're cooking food in and out of working with people. We've also had, so you think of a cook in a restaurant. I know people have ideas of highfalutin chefs and dropping little stuff on, plates and whatnot, but most cooks in restaurants, it's not a high-paid job. It's a labor-intensive job, and you're in there in a closed environment with a lot of other people. Utility workers, construction workers, when you're doing certain work inside, these are a lot of the jobs where we're seeing that spread because those people have to work so closely together, and there's not often not that much they can do about that. So I think NPS has done a great job. They're, given that we have 5 elementary schools, the newest of which was built, I think, sometime in the 60s, they're doing the best to keep their distancing. I know the facilities department is running themselves ragged, keeping the buildings clean. Our spread, I think what you'll see today when you see the state's numbers is a lot of other communities entering into the red, because remember that Norwood, even though we like to think that we're our own little bubble, but our geographical boundaries are just a magical line. It's just a line drawn on paper. Where people live here, but people come in to work here, and people from here go elsewhere and work. So that's why, if we were to try to shut things down at a local level, for instance, it almost wouldn't make a difference because you may live in Norwood and work in Canton, or you may live in Canton and work in Norwood. So thank you, Amanda. We will continue to bring these in. Thank you, Catherine. I hate to be as blunt as I am, but you're right. We've seen some cases, and they're infuriating, where people have just done really stupid things, and it's like, well, this wasn't, hey, I haven't seen this long-lost family member in years, and it's my last chance to see them. It was, oh, I'm going to go hang out with somebody. Question from Amanda. The coyote population. It does appear to be growing in town. We can only really take action if they appear to be rabid. We do have the health department looking into it. It's what we believe a natural result of, there's less cars on the road, there's less people out doing things, and nature has sort of reasserted itself. We are reaching out to the state to see what we can do because we're a little concerned about it. And again, if there is a coyote, you can always let animal control know. We generally can only take action to put the animal down when we believe it's rabid. But I know I am a chicken when it comes to stuff like that. So if I see one, I'm certainly running right into right into the house. But okay, on Monroe Street, I'll have animal control check it out in particular in the neighborhood and see if he can patrol it more. And we are working with the state to try to see. Usually you can get special permission to do something when you feel your population has kind of gotten a little out of control. And we sort of see that it's getting a little bit out of control. But there's it's same thing with turkeys. We occasionally get calls for turkeys on the side of the road, and unless they're rabid, there's not much we can do. I, of course, am not as afraid of the turkeys. The coyotes are a concern, but they fall under the same sort of regulatory framework. But we will look into whether or not, and we'll see if we can escalate with the state to say, look, this is a growing problem. Can we please do something to take care of these coyotes? A couple questions from Julie and Katie. What happens with Norwood now that we're in the red? So in the short term, nothing changes, but the reason is that the governor has moved the whole state back to phase 1 of step 3 or step 1 of phase 3. So that reduces the outdoor gathering limit, it reduces the indoor gathering limit, it reduces capacity in a lot of places, but it's sort of, they went from 50% to 40%. So most of our town facilities where that would apply to, we were already sort of operating at the lower number just because it made sense for us to be able to operate at that number. Just because you can operate at 40%, sometimes it doesn't mean that it's necessarily a case where something could be done. So nothing directly will change. Once we're in red for a couple of weeks, we will look at the numbers. I know the schools, after a few weeks of being in red, the school committee will have a discussion about continuing in-person learning or going remote. The challenge is to move back to phase 2, which is sort of the next level of shutdowns. The governor really has to do that. Us trying to order to do that here in Norwood would not only be probably met with a legal challenge that we don't necessarily have the same authority that the governor does under the Civil Defense Act. The other, which was recently upheld at the SJC, the other challenge is that it's not likely to make a number difference for Norwood because we go to other towns and other people from other towns come here. If we're definitively in the red for a couple of weeks, we may look at curtailing some services. But again, the idea behind that would be what can we curtail that's not essential to keep other essential services open. So you think of town hall. We could go back to having town hall closed because you can do anything remotely. The challenge with that is that there's really not a lot of risk of spread there. The only other two avenues we have, the civic and the library, if we curtailed services there, we're denying the public some services. If it's not happening everywhere, there's really no difference that you're going to make. So we're going to sort of harm operations, reduce the ability for people to stay quarantined and to stay healthy and not really do anything. And we want to make sure any actions we take are going to make a difference. Sports are complicated, Katie. They're all being looked at differently. It has to do with the type of contact sport that it is. So I believe the state's supposed to be releasing more guidance, if not today, than this week specifically on sports because everything tends to be a little bit differently. I'm of the opinion if it can't be done outside, they should probably look at postponing it, at least seeing if things can be canceled through December and maybe January and let the vaccine get here and things get a little bit out there. Amanda, we will actually look at Monroe and the Callahan area. I was driving around that area the other night looking at Christmas lights. Callahan area. Let me make a note and see if there's something we can do because it is, we're getting reports from all over town. It used to be just once in a great while you'd hear one of them, but we are an animal-friendly state in Massachusetts, which sometimes limits our ability to do it. But we're looking specifically whether or not we can do a catch and release. That actually would be a good idea. Personally, I'd like to catch them and release them somewhere in Maine or New Hampshire so they don't come back. But if it can be done at Blue Hills, certainly the easier the better. But that's a great suggestion. Julie, do I think the governor's new restrictions will be enough to move us back out of red? The short answer is, if I'm being honest, probably not. The difference between phase 3, step 2, and step 1 is not significant. There were a couple of things in there. I mean, the outdoor gathering capacity goes from 100 to 50. There's not likely to be too many outdoor gatherings. Capacity from 50% to 40% is not that big of a deal. There's a few other smaller changes. You're not supposed to have live performances, but even that's, one of those things where, okay, but if you have somebody playing guitar in a corner of a restaurant and they're, 6 or 8 feet away, is it really a risk? I mean, it's something that's not essential, but that's the challenge you run into is there was that guy from Brown University who was criticizing the governor recently, and he says, well, you should be shutting down tanning salons. They're not essential. Well, for some people, that job is essential. It's essential for them to have housing and food. Is a tanning salon essential or a nail salon? No, but we're not seeing any spread from tanning salons either. So I know we feel this natural instinct, well, we want to act and we want to do something. You shut down tanning salons, you could shut down every tanning salon in the state for 100 years and it's not going to change infectious diseases. I know the public health folks would probably say tanning is bad for you and there's other benefits from it, but that's the challenge. We don't want to go into a hard sort of phase 1 where everything was shut down. And originally when they envisioned doing shutdowns back in April, it was thought to be much shorter than they ended up being because it took us 3 to 4 weeks to see that decline, that sort of precipitous decline in our numbers. But then you got to keep that going for more time. What I think the state's doing, and I'm not necessarily sure I agree with it, is, and things change day to day. When we found out that the state was getting rolled back to phase 1, we got an email 24 minutes before the press conference, which is good. It's more advance notice than we usually get that these things are happening. Usually we're watching them with everyone else. The vaccine's going to start arriving soon. I don't think that's going to have an impact on the numbers for a little while. But once healthcare workers are vaccinated and, the most vulnerable among us in nursing homes and nursing home staff are inoculated, that percentage of the population which is high risk can no longer potentially catch COVID, or at least will have a much more mild case. So that should start to delete the numbers, but we're always, 3 to 6 weeks from the numbers showing the actions of what we did today. So we're still just seeing some Thanksgiving numbers if there is Thanksgiving spread. So even if tomorrow the governor said, shut everything down, everything is shut down, we're going back to the way it was, what you would see is it's a couple of weeks before that takes an impact. If you shut down hard enough and the numbers get small enough, by the time things creep back up, the vaccine will be here. So I sort of wish our numbers were here. I never wish our numbers were here. I wish our numbers were here 30 days from now or 45 days from now when the vaccine's already being distributed, because then you can maybe do a short-term shutdown. Maybe you can say, look, everyone just kind of stay at home for 2 weeks and calm things down for a little bit, take a little winter vacation, and things will look good. Travel's been shut down effectively for a while. Some people are still traveling, but most of us are stuck here in Massachusetts. So do I think the governor's actions will make a big difference? Probably not, but it remains to be seen. He rolled bars back to 9:30, and the state has said that they saw some data that was working. I'm not sure that was necessarily the case, but they look at different data than I see. Prior to that, we've been seeing a slight crest of the numbers in Norwood. But obviously that's been going on for a few weeks now, and we're seeing the numbers go up. And we're not seeing 80% of cases where, I was at Thanksgiving dinner last week. A lot of people did seriously restrict their Thanksgiving dinner. But we're seeing those cases now, and of course those cases tend to spread. So that's really a long-winded answer of saying I support everything the governor's done. I think he's done a great job overall. I don't know if rolling this back is going to make that much of a difference, but it'll take 2 to 3 weeks to see. Whatever gets done really does need to be done on a statewide basis. You occasionally have towns here or there that want to jump ahead or jump behind, and what we're seeing is those things really don't make a difference to what people do. A nearby town in Norfolk County, and it's a wonderful town with many wonderful people living there, recently had to shut down a government building because a bunch of people went to a retirement luncheon for somebody who was retiring. That town has also closed their parks. Well, we've never closed parks here in Norwood, and I don't think we would. But when 6 people go to a party and have lunch together that aren't normally doing that, and then you have a whole bunch of cases from it, well, what did you shut the parks down for? Because you likely prevented 0 by shutting the parks down. But if people had just been a little bit smarter and not had such a big group gathering for something that, could wait. I've got some long-term town employees retiring in the next month or two. Some have been with the town for decades, and it's, they're being told, we appreciate what you've done, but we're not going to celebrate it till the spring. Kate, no update on the hospital. I do have a call with the hospital CEO either tomorrow or Monday to see where it's an update. The last we'd heard is we're hoping that they get word from insurance that they're able to proceed sometime this month. The last I heard is it was hopefully December is when they would hear. Their testing trailer is up and running, and the public health department, Segal and Stacy, and the rest of the staff there are very happy with the testing trailer at Norwood Hospital. We're still looking at no ER and no large hospital project probably for a while, or I should say, even if they were to begin a project in January or February, it's going to be a large reconstruction at the hospital. We did get a question. There were some of the big tubing that was piping in temporary air had been removed, and folks wondered if that was a sign of anything. They've just reached that point in their sort of stabilization work that they didn't need those anymore. But unfortunately, no new update on the hospital other than we're waiting to hear anxiously when they get the go-ahead that they can go ahead and put forward what their new project is going to be or what they're going to do for a major reconstruction of the hospital. I do want to talk for a minute. Great questions, folks, everyone, by the way. I love getting the questions. I do want to talk for a minute about the vaccine. The state has released the framework for the vaccine. It's going to go to healthcare workers first and workers in assisted living facilities, nursing homes, and those patients. And we believe first responders will be early on. There'll be a second sort of phase of the vaccine where teachers are included in that second phase, as well as utility workers, and public health is sort of in between the two, and people with some comorbidities. And then phase 3, I believe, is sort of the general population. There's hopes that the general population can begin getting the vaccine by mid to late spring. If we could see a crest in our numbers, we could see this spring roll out much the way we did last spring, where outdoor dining can start in May or April. I mean, it can continue going on. It's just a matter of the weather. And we could have possibly a celebratory summer with the majority of the public starting to get the vaccine by April or May. We've talked before about people having concerns over the vaccine, and certainly I understand every time you wonder what something is this new? Is this going to have long-term effects? From a scientific standpoint, it has gone through testing. Usually when people have a negative impact from taking a new pill or something like that, it's something that you take for long term. Usually when they say that A is bad or B is bad, and studies have shown that this leads to this, it's usually continued long-term taking of something. vaccines you're going to take, and then you get your second shot, and you may need to get it next year. But similar to the flu shot, there have been no long-term impacts of people who've been getting the flu shot for decades. I'm going to get the vaccine as soon as I possibly can because I want this to be over with as soon as possible. There's some people who may irresponsibly say they don't want a vaccine, and I understand people who have genuine concerns. We have had data for decades on drugs and alcohol and fats and oils and sugar and the need to exercise, and we don't pay any attention to that, or at least most of us don't. And I think I've used the excuse before. We all know that we should have exercised 30 minutes today. I certainly didn't. There's plenty of warnings out there that we don't follow. It's not a reason not to follow those things. We all should exercise and eat healthy, but I'm confident that the vaccine is going to be perfectly safe. I can't wait to get it as soon as possible and get it out there to as many people as possible so we can save lives and get back on with the living of our lives. A lot of people lost money, and a lot of people have lost loved ones, lost their health through this, and we've all lost time. And that's probably the one thing that we can't get back is the time that we lost. One thing I do want to also say about the vaccine, when it does start getting out, there will be a more formal rollout process. It'll likely be through either pharmacies or through your doctor. There'll likely be scams out there, so the vaccine is going to be free. And I want to be clear, you are not going to get it in your cousin's basement. You're not going to get it in your friend's garage because he knows somebody who works at Moderna or Pfizer or works at a hospital and gets it. You will get your vaccine from a qualified medical professional in an official manner. If you see them for sale online, don't buy them online. Don't just grab it and say, ooh, Billy gave me his because, he's a police officer and didn't take it or anything like that. None of that is hopefully going to happen. When the vaccine comes out for the public, again, it'll go through either your pharmacy or you'll be able to get it through your doctor. There might be inoculation settings set up. We've drilled for that for years and we'd be prepared to do that, but that would again be something very official. So when the vaccine does come out, please beware of scams. You will hear officially from us once we know something about where you can go get it, and it'll likely be from your hospital, your doctor, or your pharmacy, or from public health if we did sort of town-wide inoculations, but we're not sure that that's actually going to be the way they choose to roll it out. So please beware as that comes out. You'll also probably hear some negative stories as the vaccine rolls out because the media, God bless them, they love negative stories. There's going to be a production issue where a batch has to get destroyed, or there's going to be somebody in a factory is going to complain that it didn't go through a process, or a truck is going to get in an accident and a number of vials are going to get smashed. I mean, these things are just human nature, just like everything else. There's going to be a fire alarm at one of the factories. These things will happen. Take them in stride that this is a massive undertaking. We are all human beings and we're going to continue to human. So that means that somebody's going to back a truck into something and one truck's going to go off the road and the power is going to go out at a distribution facility. And don't think the worst. It's a process. Millions of doses are coming and they will get out there. So when you see in the nightly news that A happened or B happened, they already did it in Great Britain where they've started vaccinating people where they said, well, folks who have food allergies probably shouldn't get the vaccine or maybe shouldn't get it right away. Those things will come out. I think anyone who's a doctor or a nurse will tell you that's sort of the common advice. There's going to be a little bit of, I think, swelling at the site. You might feel a little sick for a day or two. That happens just like with the flu vaccine. It will happen. Take it all in stride. There is a vaccine coming, and my hope is next summer we'll be back to normal. Reminder to wear your masks, practice social distancing, do things safely. You can pay your bills online at Town Hall. Another reminder, you are required to wear a mask entering town buildings. If you have a medical condition, call us ahead of time. You are still required to wear a mask. I did have somebody in Town Hall the other day that didn't have a mask on. You will be politely asked to leave any town facility. Please wear a mask. It is the minimum that you can do. Little kids are wearing masks for like 6 hours a day, and I know the masks get frustrating. Teachers are wearing masks for 7 or 8 hours a day. So if a teacher can wear their mask all day long in a classroom, with your children especially, if you're a resident of the town, you can wear a mask when you come into Town Hall or go into any other places. I know they're frustrating, but the more we do it and the better we do, the quicker we can get to a point where maybe we don't have to wear masks ever again, or at least not for another 100 years. A couple of announcements as we go on, and I'll still be happy to take any more questions about the vaccine, though I'm by no means an expert, or our COVID numbers. The mailbox at the Civic Center for letters to Santa is up until Monday, so please get those in if you need those letters mailed out to the North Pole. The Student Council store is up until I believe December 14th, so there's a chance to get some great Mustang gear and support the classes and the Norwood High Student Council. I know I'm going to be putting in a big order in the next day or two. They got tons of shirts and sweaters, and I got a couple of great hats last time, and I may get a few more hats. December 16th is the last date for the weekly family meal program. We may look at whether that can be brought back. We've got to see if we can identify some funding or some donations for it, but it was a great program. You can sign up through the school's website. There's one more week of that. They delivered a couple of the meals to Town Hall. I had the sweet and sour chicken yesterday, and it was delicious. They do a great job. I cannot tell you how great of a job our food service workers have done throughout this entire pandemic, feeding thousands of children, going to work every day, and working on new and unique programs like the weekly family meal program, which is a unique to Norwood program. The rec department is doing a holiday parade Sunday at 3:30. The route's changing a bit. The rec department will be getting that online and out via social media soon. We're asking people not to gather at the Common. There won't be an event as there has been in the past. They're going to try to take the parade through some of the neighborhoods and give people more places to be able to watch it, so that way people can socially distance themselves. And please wear masks when you're watching on the parade route. It will start at 3:30. A new map will be distributed online either tonight or tomorrow by the rec department. We'll get that out to everyone for the parade. The menorah lighting is this Saturday at town on the town common. We're asking to keep it to minimal. It's limited to a maximum of 50 people plus social distancing. But Rabbi Horowitz will be out here with Aaron and Martha Greenstein to light the menorah. I believe it's this Saturday, either 5 or 6 o'clock. It is already up. That was the date that everyone chose. It will be live streamed, and we'll get that out on our social media, and NCM will be covering it as well. So we would prefer, if you can, watch it from home, but they will be doing that official. It's a third year running for that, but they will be keeping it small. And the last item I want everyone to just think about for down the road, because we want to think ahead to when this pandemic is over, because it will end. That end is sight, and it's getting closer every day. We still have a lot of work to do, and there's still going to be a lot of hard work and a lot of tragedy between now and then, but the end is coming of this pandemic, and it will be good. We've kicked off some of our holiday celebrations that we normally do, town staff celebrations, until July. So if anyone's interested, start thinking about sort of a Christmas in July and what kind of community celebrations we could do to celebrate what many of us, I think, will remember as the Christmas we couldn't really have because of COVID. And we're heartbroken that we know this will be some people's last Christmas, as it always is. But think about what sort of celebrations we as a community want to do once we're through this and once we can come together again. And we've been thinking about, we're going to just, the first week of July is Independence Day. What a better time to celebrate that we're free and healthy and free from this virus by having our Christmas parties in July, and maybe people can put up holiday lights if they like, but something to think about as we want to think forward to more positive days and the days when this pandemic will be behind us, which are coming. They're not quite there yet, but we're almost there. That is all I have for my announcements today. Joe, our wonderful producer for the show, is putting in some comments there about Santa's parade, as well as some other items. And we're going to look into the coyote issue, which is a growing issue. If anyone has any other questions, I'd be more than happy to answer them. We will continue to bring these every week. We will probably take a break around the Christmas week. I don't know what the date for the holiday is, but we'll do probably take a 1 week break, and then we'll continue them on as we bring information. And I look forward to the day where they're no longer COVID updates, and maybe they're just COVID stories or COVID memories and just other updates about the town. You can always email us at managers@norwoodma.gov, managers@norwoodma.gov. And with that, you can also post comments and the questions. I think I've covered all of them. I hope everyone has a wonderful day and a wonderful weekend. Please stay safe. Please keep other people safe. Continue to wear your masks and do all the safe things that we do, and we're almost on the other side of this. I want to thank you, everyone, for joining us, and thank you for joining us every week, and please stay safe out there.